Hi, I'm Dr. Darren Fitzpatrick. Name of my practice is Natural Solutions Health Improvement Center, and I want you to watch the next video and learn something about how you can take care of yourself naturally. Hi, I'm Dr. Darren Fitzpatrick. The name of my practice is Natural Solutions Health Improvement Center, and we're located in Fort Myers, 2130 McGregor Boulevard, close to downtown. I'm a chiropractor by training, but most of what I do in my practice is clinical nutrition with patients. I realized a long time ago that chiropractic is really good, but if people are eating a crappy diet, chiropractic's not going to do a whole lot of good. So we had to add some nutrition in there, and I realized that my patients were getting better and better on nutrition than just chiropractic alone. So now we do a lot of nutrition. If you're watching this video, you're probably already a patient of mine or a prospective patient of mine, so welcome. This video is going to be just an introduction to what we do, nutrition response testing. That's the name of the technique. The purpose of our practice really is to help as many people as possible regain their health naturally and through education without the use of unnecessary drugs and surgery. So our goal is really to rebuild the foundation of health that's been lost in our patients and keep them kind of out of the medical model altogether. We realize that medicine can be a stressor to the body, and we want to reduce as much stress to the body as possible, because we know that the body was made to heal itself. And if you don't know that, now you know. But if there's no impediments to that healing, the body does a beautiful job of healing itself. You really don't have to think about healing a cut. Cuts just kind of scab over and go away in time. That's because the body's intelligence is taking care of business. You don't even have to think about it. So it's the same thing with everything else, as long as there's nothing that's stressing the body. So I'll give you a little background into my health. As a child, I was suffering from some sinus issues, sinus congestion and drainage, kind of frequent colds, frequent bronchitis, that kind of thing. I was having some gastric issues as I went through my childhood as well, frequent constipation and indigestion. So I've dealt with a lot of the things that my patients are dealing with as well. So I'm a human just like you. Those symptoms actually got worse for me over time. As I grew older, I didn't really do anything to change what was going on in my situation. So when you don't change anything, things typically tend to get worse. So I finally got into chiropractic college, and I took a lot of nutrition in chiropractic college and realized that nutrition probably had a basis in what was going on with me. So I started researching nutrition more and more, and started changing some of the things that I was doing in my life nutritionally. When I got out into practice, I started dabbling in nutrition, so I started using a really good quality nutritional supplement with patients, and I was kind of just guessing what supplements that they needed based on their symptomology. So if they had sinus congestion like me, I had 4 or 5 different things that I could use for that, treating that symptom. And I did that, and it was kind of a hit or miss proposition. So some people got a little better, some people got really good results, and some people didn't get any results at all. The good thing though with nutrition is the worst thing that can happen is nothing. So, but I really want results for my patients and myself. So I eventually found a technique that actually allows me to talk to the patient's nervous system and find out exactly what's going on in the body and help their body actually work better. When I was first exposed to this technique and got tested myself, I found out that there were 3 things that were affecting my health that I had no idea that were happening. So I found out I had a wheat sensitivity that was causing a lot of inflammation and just ruining my digestion. I also found out that I had a underlying viral issue that was going on. There was a virus that was causing some inflammation in the body and really halting how my body worked, so it was acting as a stressor in my healing. And I also had an underlying heavy metal toxicity, specifically mercury, and I estimate that was probably from all the amalgams I had. I had a lot of dental work as a kid as well. So the practitioner that found all those stressors put me on a program to deal with the stressors and gave me some supplements to help me with an organ that was giving me problems, namely my liver. And we cleaned up my liver and my diet, got rid of those stressors, and in 6 months I was feeling great, lots of energy, and I'd lost 20 pounds without even exercising. So I was hooked. I knew this worked, and I wanted to use it with my patients as well. So I took all the advanced classes that they offered. It took me another 2 years to get through all of that training, and now we see some really difficult cases in our office. I'm really not concerned with any kind of case that comes through our office. I feel like we can handle it with nutrition, so to at least to a degree. So that's my story, and we've been doing this particular technique for about 10 years, actually over 10 years now in our practice, getting great results with patients and getting referrals all the time. One thing I have to let you know though is that anything can cause anything. So what I mean by that is, like in my case, I had no idea I had an underlying viral issue happening, and that virus was messing things up. I had no idea of that, and it was affecting organs that I didn't even know were affected. So we find some really crazy stuff in our practice as far as what's affecting people, but you got to keep an open mind as far as that is concerned. So we do find anything causing anything in patients' health. As far as the way we approach health, we're not looking at treating symptoms. What we do is look for the underlying cause that's causing those symptoms to happen. Symptoms simply are just a red flag that your body is throwing up to show you, hey, there's something wrong. It doesn't necessarily mean that area where you're experiencing the symptom has something wrong with it. For example, if you have neck and shoulder pain, chronic neck and shoulder pain, you would think that would be possibly a chiropractic issue or massage therapy would help. But I've seen many patients that have chronic neck and shoulder pain, and it relates back to an underfunctioning thyroid. And once we handle that underfunctioning thyroid and get it back on track and working right, the pain just simply goes away. There's no need to treat the pain. So from a medical standpoint, medicine is really designed to treat symptoms. That's all medicine's for. But it never does anything for that underlying cause that's causing those symptoms, and that's where we differ. We're actually looking for that cause and getting a permanent result and eliminating the symptoms at the same time as a byproduct. So that's fun to do, and I see patients just get healthier and healthier along the way, and that's really the basis of our program. That's the philosophical basis. When I'm explaining how this all works with patients, we look at symptoms because symptoms are the important part to the patient. If you can envision a triangle, at the top of the triangle, we can write any symptom up there at the top of the triangle. So if we're dealing with pain, we can just put pain up there. And if you envision the lower left-hand corner of that triangle, what we're always going to find with a symptom is an organ dysfunction. So organ dysfunction is part of that triangle, and the other leg of that, or the other corner of that triangle, would be nutrient deficiency. So if we've got something going on in our body that's causing us to have some symptoms, we're always going to have an organ dysfunction, and we're always going to have nutrient deficiencies, because the nutrients are the fuel for the organs, and we know that organs aren't working right already. So that can turn into a vicious cycle where the organs become more nutrient deficient, the symptoms get worse, the organ function gets worse and causes more nutrient deficiency. So that can go around and around and get worse as time goes on. Again, if you don't change anything, you're going to experience some worsening of those symptoms and those underlying problems as well. One thing that I always kind of hammer into my patient's head is that sugar does the same thing. Sugar causes nutrient deficiencies, and sugar causes organ dysfunction. We have a handout that we give our patients, and if you'd like one, you can just ask me for it. It's 143 reasons why sugar is ruining your health. And we had to type that really, really small to make it 1 page worth of things that sugar does, but I'm sure there's many more things that sugar actually causes in our health that's bad for us. So one of the main things that sugar does, I mean, you can take sugar into your mouth and spit it right out, but it'll immediately cause a cascade in the body, causing inflammation in the brain, the liver, and the joints right away. You don't even have to ingest it. So sugar's a pretty potent poison in our body, and if you're eating sugar all the day, you're in constant inflammation, and we all know now that inflammation is really the root cause of a lot of degenerative diseases that we're seeing today. So heart disease, cancer, Alzheimer's, all of these degenerative diseases that we're seeing, diabetes specifically is a sugar disease. So if you're eating too much sugar, you're on the road to those kind of diseases. So we really need to knock sugar out of the diet. As far as nutrition response testing is concerned, this is the main technique that we use to address these issues. That allows me to actually find the organ that's actually dysfunctional, find the nutrient that the organ needs, and put a stop in that downward spiral of health, and really reinvigorate the patient and work on that foundation of health that's been lost. So the way nutrition response testing works is we're actually utilizing a protective mechanism in the body that kind of shunts energy away from areas to protect other vulnerable areas. So for example, if I'm doing a body scan on a patient, when I'm doing a body scan, this is a muscle testing technique, so I'm pushing on an arm to see the tone of the muscle in the arm. And if we get to an area that's already stressed out, like the thyroid, and I'm putting a little bit of pressure over the thyroid itself, the body senses that extra stress and shunts the energy out of the arm that's already strong and towards the thyroid to protect an already stressed thyroid, and the arm actually will go weak at that point. So whenever we have a weak response in a muscle, we know that whatever area that I'm testing at the time is stressed, and we just have to find out why that's stressed and what that area needs to actually get some energy in it and come back to life and heal itself. So we use test kits to actually find out what the stressors are. There's 6 major stressors to humans. So we test for food sensitivities. We test for immune challenges like bacteria, virus, parasites, and fungus. We also test for 35 groups of chemicals, 35 heavy metals. We look at radiation, and we also test for scars. Scars on the skin can cause us problems as well in our nervous system. So we figure out if any of those stressors are problematic, and then we handle those, and then we give some support products to the organ, and then we just monitor the patient over close monitoring over a period of time to make sure that they're making improvements. During that time period, we're also working on diet as well, because if somebody's eating suboptimal food or lots of sugar, they can override what we're doing with our whole food supplements and really not get any improvement at all, or very little improvement. So we really have to work on the diet. The supplements are the tools that we use for short-term healing and to really get the patient better quicker. But the diet changes that they're trying to educate them about is really more for long-term, the rest of their life, to stay healthy. So that's kind of in a nutshell how that technology works. When we're doing the testing for the patient, we're actually building a customized nutrition plan for that patient. So everybody's different, everybody's biochemically different, physiologically different. So when we're doing our testing, we can find exactly what's going on in that patient and exactly what supplements that they need and the exact right dose that they need to get well. So you don't have to guess at how much you need to take of what particular supplement. It's very customized to what's going on in your body at that time. And the supplements we use are very high quality supplements. We make sure that we're working with companies that have been around for a while, and they're using high quality ingredients in their supplements. Most of the supplements we use are whole food supplementation, so there are no synthetic isolated vitamins in those supplements that may cause problems. We also use some homeopathy and some herbal products as well to kind of kickstart programs into the right direction. One important thing that people need to realize when they're doing a nutrition program, though, is that it does take time. So we're working at the cellular level in the body, and there's something like 70 trillion cells in the body, and we really are working at that level, and it takes time for those cells to overturn, be exposed to new nutrition, and those cells make up tissues, those tissues make up organs, and those organs make up systems. So it does take months to potentially years for people to restore their health. But I have plenty of patients that have been sick for 20 or 30 years, and a year or two really is a pretty good deal if they can get better in that amount of time. So, but it's not an overnight miracle stories, although I've had those. They're rare, few and far between. So if you are not already a patient of mine, then I would urge you to come to our office or find a nutrition response testing clinician in your area and get tested and find out what's going on in your health. You can get specific answers very succinctly, very quickly, without doing any blood work or MRIs, any x-rays, any in-depth testing. We can find out most of what we need to do to get you back on track with your health. So you can either call our office or call somebody in your area. You can always just contact ULAN Nutritional Systems in Clearwater, Florida. They can get you somebody in your area that can help you. Thank you.